My name is Key Siadan. I'm a regional director of sales and strategic alliances with Silverado, the world leader in providing care for those with memory impairing diseases. Now, whether it's through our innovative clinical models of care for our residents, our world acclaimed evidence based Nexus program for early stage dementia that combines science and social engagement, or the many partnerships with global leaders in medical and scientific research, Silverado is not only committed to changing the lives of those with memory impairment, but through education and by example, eradicating the stigma surrounding all dementias. We're currently changing lives in 22 communities across 6 states. Our speaker today is Dr. Mehrdad Ayati, well known nationally and internationally in the field of geriatric medicine. He is a physician, a speaker, an author, and an educator. Dr. Ayati is the medical advisor to the United States Senate Special Committee on Aging, providing medical advice on aging and challenges faced by the aging population in the US. Dr. Ayati is an adjunct assistant professor of medicine at Stanford University School of Medicine, where he teaches geriatric and internal medicine. He joined Stanford University School of Medicine in 2011 as faculty, where he taught and practiced internal medicine and geriatrics at the Stanford Internal Medicine Clinic, the Stanford Senior Care Clinic, Stanford Concierge Medicine, and Stanford Executive Medicine. Dr. Ayati is a member of the Ethnogeriatrics Committee of the American Geriatric Society and serves as a faculty advisor for the Center on Longevity at Stanford University. He is a member of the Healthcare Advisory Committee of Northern California and Nevada chapter of the Alzheimer's Association, and is a geriatric consultant on aging research projects at SRI, the Stanford Research Institute International. Dr. Ayati is the editor-in-chief of the Journal of General Medicine, Open Access, and is the co-author of Paths to Healthy Aging. He is the founder of the Bay Area Senior Care Society. Dr. Ayati, I want to say thank you so much for joining us today, and we're all excited to hear your presentation. So thank you so much.
Thank you so much. I appreciate it, Keith, for the warm introduction. I'm so pleased to be here. And again, it's wonderful that we can actually connect this days through the virtual, and we can see many people as well, and they can actually get their education through this new platform. Let's talk about natural daylight. And the main thing we wanted to talk is about sleep. And the reason I want to talk about is sleep, because the daylight is part of the sleep pattern, and we need to learn a little bit about the sleep physiology till we able to understand what does it mean with the brain circadian rhythm and the rest. Before I wanted to start, I have to say that I don't have any conflict of interest about the topic that I'm talking right now. And again, not getting paid by any pharmaceutical or biomedical, biotechnology company or biomedical related to the topic that I'm talking right now. Sleep change, it's one of the topics that we want to talk about it. And the main topic that we're going to talk is a brain circadian rhythm. Why do we need to sleep, and the change of sleep as we age, and some strategies to improve the sleep with more effects on dementia and also cognitive impairment. The main thing that I wanted that we all learn is about brain circadian rhythm, exactly what we're talking about, daylight, and why the light is important part of that. Some of the question that we're able to answer at the end of this topic is some of the major simple things that people talk about it. Like, for example, why exercise help us to sleep better? This is always a question a lot of the patient ask, that what's the relationship between exercise and sleep? Why light is very essential for brain function, and why is sleep necessary to, or a standard physiology of our body, and why when we become older, we have more complaint about sleep, and why a lot of the people, they're not able to sleep in nursing home and hospitals and especially in facilities, and the people with dementia have more problem with the sleeping, why it happened. Now, the first things we wanted to say is some opinion about the sleep. And I just want to share with you some of the opinion the people had, the famous people about the sleep. The one from Ernest Hemingway is, I love sleep. My life has the tendency to fall apart when I'm awake, you know. And the other one is, dear sleep, I know we had problems when I was younger, but I love you now. Dalai Lama says sleep is the best meditation, which is true. And there's also a very funny thing that is sleeping is my drug, my bed is the dealer, and my alarm clock is the police. Now, before we wanted to start, I wanted to say the biggest lie that happened in the history of human was this statement that early to bed, early to rise, make the man healthy, wealthy, and wise. That's not true anymore. We know that people actually are sleeping more. They have much better brain function, and it doesn't not necessarily the people actually sleeps less. It means they're smarter, and actually the sleep is one of the major therapeutic things for happen to the brain, which we're going to talk about it. Sleep is a very important part of the life, and it still is a mystery. We have half of our life we spend in the sleep. For example, if somebody age, I mean, this days is very easy. Everybody age till 90 years old. We almost spend 33 years of our life in a sleep cycle, which is a very, very important part of our life. When we have a sleep, technically our body get paralyzed, and our eyes is still moving, and we still have a feeling of flying, and kind of like they call it approach to frontiers of death. These are from Freud, actually, the sentence. Every night our brain go to a startling metamorphosis, which is true about the sleep. Is an amazing part that why the brain does that, and I'm going to explain to you why, because then we can have the connection between the light. And we are always, I mean, this is based on a history that why we are doing all of these things during the sleep, and why, and there should be reason. Now, the reason that we know it's about, probably one of the things that I want to say, this gentleman, you may hear about him, he just recently passed away, Dr. Dement. He was the father of sleep medicine, and he was actually working at Stanford. Many things we know about the sleep, brain circadian rhythm is actually because of his work. After he became semi-retired, he started to writing newspaper and the books. One of the books that actually made was a Sleep Walk with Me, that it was a very nice movie that actually based on what his experience about his sleep. I encourage you, if you wanted to look at it, it's kind of like a comedy, but it's kind of like giving an idea of what does it mean with the sleep cycle. I just want to quickly talk about it because this is not a topic that we're going to talk about it today, but I wanted to tell you about this topic because this is the sleep cycle. It is important to understand the sleep cycle. We have two sleep cycle overall. One sleep cycle that we have, it's non-REM, which is we call non-rapid eye movement asleep. And the other one is rapid eye movement asleep, which is we call REM. Now, every time when we go to sleep, like for example, if you're sleeping at 10 o'clock at night, we go to the non-REM and 1-REM cycle, which usually takes around 90 to 110 minutes. Like for example, if you start a journey at 10 p.m., we're going to go around like almost around 12:30 or maybe 11:30 to this cycle. What happened is we go for stage 1, 2, and 3, which these 3 stages are non-REM sleep. I'm just circling here. Now, during the stages, we get first light sleep, our muscle brain activity decrease. We go to stage 2, and then our eye movement and muscle activity stop, and the brain has a very, very slow wave at that point. Technically, in non-REM sleep, especially stage 2 and 3, we are in a very, very deep sleep. Then we go to this cycle, which we call rapid eye movement. Suddenly, our heart starts to increase the rate, the breathing is start to going up, blood pressure is going to go up, and body is paralyzed. But what we see, our eyes move so fast, and we started to have dream. Every cycle is around 90 to 110 minutes. Now, we may wake up between cycle. Some of us, we will go to the bathroom. Some of us, we may come back again. And if we are lucky, we move from one cycle to other cycle so fast. And then during the night, we have like a 3 or 4 of these cycles, which is going to be 6 hours or 7 hours of sleep. More we go toward the morning, we have more REM sleep. Means that technically REM sleep is the time that we wake up in the morning. And sometimes we have some anxiety because still our heart rate is elevated or respiratory rate is increased. A slow wave, which is the stage 1 and 2 and 3, it's a very, very deep sleep. Whenever you don't sleep for a long time, like 24 hours, the first thing happens, you find the bed, you even don't want to change your clothes, you just go and jump to the bed. It is a very, very important because it's very, very restful. And what we see that our vegetative body function and peripheral vascular tone significantly decrease. This is a very, very important part because our blood pressure drops in this point, our respiratory rate is going to be, we breathe less, more slower, and we have a very, very basic metabolic rate at that point. And that's really, really important and very close to coma. I mean, even if the external noises may not waken us up when we are in a non-REM sleep, it's a very, very important to maintain our immune system, to regulate our body temperature, or regulate our blood pressure, or moods, and many other things. The cycle of sleep is more important than food, and technically we can die by sleep deprivation, but it's still, even we are starved of the food, we still can make it for weeks. But a sleep deprivation can kill us if we don't get non-REM sleep for a period of time, because our body, technically entire physiology, depends on this cycle. When we have REM sleep, which is a paradoxical sleep, which I told you that when we have like an average every minute, we go to this REM sleep, which is 5 to 30 minutes, and then the person is going to be, when the person is extremely sleepy, we have less REM sleep, more non-REM sleep, non-rapid eye movement, which is more deep sleep. But when we are having more naps, for example, or we're really not very tired, then we have more REM sleep. And this is very interesting. Now, REM sleep is a very interesting time because it's exactly the time that we have all our dreams happen. We have active bodily movement, which is very interesting. But what happened is, as I explained to you, that we wake up in the morning with REM sleep. What is very important that we need to understand, in REM sleep, we need to have our muscle tone to be decreased and depressed. If it's not happen, then we are acting out every single dreams that we have during the sleep time. And this is why some people, you probably hear, they have like sleepwalking. The reason they're sleepwalking because they don't get this paralysis of their muscles, and then they start to acting out their dreams. If we don't get this depression of the muscles, then we are going to be extremely moving during that time. As I said, our respiratory rate is increased, heart rate, and this is all reaction to the dream. No, it is so important, I said, why our muscles needs to be paralyzed, because otherwise we're going to act up every single dreams that we have. And one of the problems that we see in elderly and some of the geriatric complex situation, like people have Parkinson's disease or Lewy body, or the people have Alzheimer, they have REM sleep behavioral disorder. Does it mean that during the REM sleep, they're acting out their dreams? And most of the time, there's a partner in the bed, and one partner is kind of hitting the other one, and that's exactly happened. And again, the same thing we have is all about the dreams that we have during the REM sleep. Well, the most important question, which I'm actually going to go through that why the light is also going to be important, why our brain is active or shut down. The answer is our brain is extremely active, especially during the REM sleep. When we do the PET-CT scan of the brain, as you see the red area here in the brain PET-CT scan, you can see easily that we are very active brain actually when we're talking about REM sleep. And the reason is that we have increase of the metabolisms of the body. Yes, it's so important. We have lots of things that happen. Like Freud says about the REM, it's the time that we all go mad. We can have psychosis, hallucination. We can talk during this time. A lot of people say it's the time to connection to the gods. It is exactly the time that we have chaotic firing of all neurons. And many of, and for entire, again, the human, is the time that sexually we actually going to be activated. And even for women or men, they're both the same. And it's starting from limbic system, this is going to happen. Now, that comes to the very important question. When our brain is very active during sleep, then why do we need a sleep? Should we just be awake? And why the brain needs that time of activity? Because what happened to the brain exactly at the sleeping time? Because before we thought brain's getting rest during the sleep, but we know that's not true. Brain is very, very active during the sleeping time. Why we need to do that, and what's the benefit of a sleep? And that's the question is going to come here. This is the guy, I don't know if you know him, but this is Randy Gardner. He was a very famous guy that actually he was able to be awake for 264 and 4 hours, which is 11 days and 24 minutes. That was part of the study. Dr. Dement was part of the study. The study was done in San Diego, and they didn't use any stimulant, no coffee, anything in 1964, and they continuously doing the electroencephalogram of his brain, checking the blood pressure, do EKG, and see what happened to Randy after that amount of time. After Randy, some other people, they able to broke the record. I think somebody made it till 12 days in South Africa. But again, what happened is a very important thing of what happened to him. On the second days, Randy, his eyes stopped to focusing. He stopped identify the object by touch. He was not able to say this is hard, this is rough anymore. He become very moody, uncoordinated, and he becomes have hallucination after that. He has short-term memory loss. I wanted to really pay attention to this part because that's very, very important to understand it later. And then he started to have very paranoia, psychosis. He recovered completely. He's still alive, and it doesn't have a long-term damage. But we're able to learn why many of psychotic feature, memory loss, even sensory, touch, eyes, everything has been completely gone while he was sleeping. Now back to physiology. When we talk about the sleep, there are many neurotransmitter in the brain is important, but there's two signals are very, very important in our body to understand about the sleep cycle. One of them is adenosine, one of them is melatonin, which you heard about that. These are signals from our body and signals from our environment to tell our body is tired. Adenosine is the production of the muscles, is built up during the day in the brain, and is technically what we call is internal energy store. If you do exercise, if you use your muscles, you build up the adenosine. And adenosine is the reason that people get a sleep pressure, as you see in the picture. If I'm in the front of monitor when I'm talking to you, if my eyes are getting closed and I just keep sleeping, that means I have a lot of adenosine in my brain. Who blocked the adenosine? Coffee and caffeine, which we all taking in the morning, is technically, as you see here, this is the adenosine, and this is going to be your caffeine. Caffeine technically block the adenosine receptor and doesn't let the adenosine to sit on that, but it's going to be limitation. Now, the first question that I said in my topic, why exercise make you sleep better? Because when you use your muscles, you produce more adenosine. As a consequence of that, your brain's going to be more sleepy at night, and then you're able to sleep better. But what happened during the sleep time? There is a system in the brain called lymphatic system. It's produced by spinal fluid, goes to your brain, and it starts to clearing and cleaning your brain. As a consequence of that, then you're technically able to get rid of adenosine. And then when you wake up in the morning, next morning, your brain is free of adenosine and you are fresh. If you don't sleep, you still have some residual adenosine from the day before. That's why you feel very groggy. You feel incoordinated next day. You're not able to concentrate very well because you still have residual adenosine in your brain. It is so important the brain during that cycle that we talk about it start to cleaning through the spinal fluid this adenosine. The second thing, which is the subject of our talk today, is about melatonin. Melatonin is a protein. It's technically is a brain circadian rhythm, which technically help us to understand the master clock in the brain. This is the master clock. This is the time when we look at, okay, this is the daytime in California, and this is the nighttime, responding to the light. It's not only for us, animal, plants, and microbes that all have some brain, the master clock in their system. Even plants has it, microbes they have it. But again, for us, is a melatonin is the one is telling us what happened. I wanted to bring the attention here to this picture. It's a very busy picture, but I want to tell you what's going on. Here is the light, as you see here, comes to your eyes. When it comes to your eyes, it goes from the lens and then go all the way to retina, which is here. In the retina, you're processing the lights, and the lights goes to the place here, which we call supranucleus, again, SCN, or suprachiasmatic nucleus. This is the place in the brain that start to processing all the lights that happen. And as a consequence from that place, it goes to a place in the brain called pineal gland. And from pineal gland, we produce natural melatonin here in the bloodstream. Then light, go to eyes, go to this place, go to pineal gland, and we have natural melatonin in the body that is telling us that this is the day, this is the night, this is the time to sleep, this is the time to be active. Now, I wanted to answer some questions here that you may have here. When we're getting older, what happened to us? Many of us, we have cataract, or lens are not going to be very clear. That's why we have a problem with getting light to our retina. Many people, they're starting to have degeneration in their retinal area. That's why they're not able to process light very well. This is one of the reasons as we're getting older, sleeping is going to be much difficult for us. When it comes here, we get calcification of these places. Suprachiasmatic nucleus get calcified as we're getting older. And this is why we have a hard time to processing the sleeping cycle. And I wanted to tell you something. The people getting dementia, especially like, for example, Alzheimer's dementia. What happened in people in Alzheimer's dementia? They get a lot of protein that they come and cut these places. This connection is going to be cut, like from here to here, going to be cut. What else can cause that? A stroke. The people have a stroke, they have cutting of the system. They're not able to light, process very well all the way to the pineal gland, suprachiasmatic nucleus, and that's why we're not able to produce natural melatonin. That's why we're not able to understand circadian brain rhythm very well. Melatonin technically is a time messenger. It's telling us this is the day, this is the light, is producing technically during the day we get the light, and evening melatonin comes to the bloodstream, and then it starts to getting to the system and telling us that this is the day, this is the night. Now, it's so important because I wanted to tell you this cycle, which is you can understand what does it mean. Now, let's just start from here. Let me just back again my pen here. Let's just start from 9 o'clock. Imagine that you are in California. I mean, now I'm talking from California. It's like in like 9 o'clock is dark and melatonin start to comes to my system. What happened is melatonin as a time messenger is going to go tell to my bladder and my intestine area that please stop functioning. If they don't do it, we're going to be all night in the bathroom. This you can see here, the bowel movement is stopped. We're going to go to deep sleep. And at 2 o'clock in the morning, we're in very deep sleep. I will tell you, melatonin has the converse effect with the body temperature. At 4:30 o'clock in the morning, we feel extremely cold. When melatonin is high, our body temperatures go. Usually when we start the night with the blanket, we put the blanket on the bedside. But in the morning, we need the blanket. We have to put it on because we feel extremely cold. And in the morning, when we have a sunrise, our blood pressure starts to rise. Melatonin starts to stop at 7:30 in the morning. Between 6:45 to 7:30, still we have some residual melatonin in the system. This is why people are very drowsy still in early morning. One of the reasons we have the highest amount of accident in the highway is actually early morning because people are still very, very sleepy. And again, 8:30 in the morning, when the melatonin completely is stopped, we're going to have a bowel movement to start. We have high alertness at 10 o'clock. If you want to do any examination, this is the best time, thanks to Keith, to coordinate this time for our conference, because 11 o'clock is the best time that you can learn everything. And then afternoon, we have the best coordination, fastest reaction time. If you want to make any financial decision, this is the best time. And you have a very high cardiovascular effectiveness in the afternoon. This is why a lot of people talk about it. It's the best time we do our cardio exercise in the early afternoon, like before, like around like 5 p.m., 4 p.m., because our heart is in the maximum function, not very early in the morning. And that's kind of things that it can help us to understand our body. This is us. This is 24 hours, what we call a natural daylight brain circadian rhythm that we are going to talk more about it in the next slide. As we said, that melatonin is going to up at nighttime, and then it's going to have a drop in there. Then based on that, we have different kind of people. Some people are advanced sleep phase disorder. Now, what happened in these people, as you see here in the picture, their melatonin is actually, instead of going up much later at the night, it goes up much earlier in the evening. Like, for example, 6 p.m., 7 p.m. They feel extremely sleepy much earlier. and their body temperature is kind of like dropping much earlier at that time, like 2 o'clock, 3 o'clock in the morning. This is why we call it morning type people. The people wake up between 2 o'clock and 5 o'clock, and they usually go to sleep between 6 to 9 p.m. As we get into middle age to our elderly, we are this type of people. Melatonin raised much earlier in our body system. I have a point about this for you, which I'm going to share with you. The other, as you probably say, the core body temperature drops, we feel sleepy, and again, we have a gradual progress through the age. And this is why many of people, when they get to middle age toward older adult, they actually wake up much earlier in the morning, and they're always complaining about that. They have the problem to fall back into sleep. On the other side, the people have delayed sleep phase disorder. Delayed sleep phase disorder are the people that they're 2 hours usually late. There are evening type people, and most of these people are teenagers and young people. As you see here, the young people, the melatonin is not going to go up after midnight, and the core body temperature is going to drop much later. This is why they wake up around like 11 a.m. or 12 p.m. And this is the complaint and always the parents about young or teenager. But this is a very normal sleep phase disorder. And family history is going to be one of the things that it's very strongly contribute to that. Now, based on that, people have a different cycle. If we imagine that normal people are the people that, like, for example, I don't call it normal anymore because this is not true. But if somebody, like, for example, is asleep at 9 p.m., wake up at 8 a.m., we call it normal. Now, delayed sleep phase disorder are the young people and teenager. They wake up 3 a.m., they sleep at 3 a.m., they wake up 12 p.m. And as we're getting older, we sleep much earlier at the evening time, and we wake up at 2 or 3 o'clock in the morning, and we're not able to fall asleep. Well, we talk about this tree. But who are these people? They're sleeping 2 hours, they wake up. Sleep 2 hours, they wake up. People with dementia. These are exactly what we talk about it because of the blockage on the nervous system in the brain. They have a very sporadic sleep cycle. This is what we call it irregular sleep-waking rhythm. The other one is non-24 hours sleep-waking rhythm. This is exactly going to be some people with cognitive impairment, neurodegenerative, but this is going to be a very, very good example of why physiologically people with a stroke, people with dementia, they have very sporadic cycle of sleep. And this is a very common mistake that I see a lot of time, the people trying to give them medication to make them sleep 8 hours straight at night, the people with dementia. That's absolutely a wrong practice because the brain is not at the situation that they're able to sleep for 6 to 8 hours. They're going to have a sporadic sleep cycle, and they're going to be awake, they're going to wander, they get their walker if they're able to walk, walking around the house or facility, and they come back to the bed, they sleep for a couple hours, they wake up. This is totally normal physiology for the brain, and any a sleeping medication for them is really not going to be helpful. But the life of a human has been changed because we have a lot of the artificial lights in our system, TV, monitor, computer. When we look at the history, we've been technically living in cave in the darkness. And then when we have the agricultural life, then we start to do the agriculture during the day. And then nighttime, we goes to our houses in the darkness, and then we sleep. I wanted to, but because of this gentleman, Thomas Edison, he invaded the darkness, and we have a much brighter environment. That makes the brain to become confused as well. And that's something that we have to pay attention. I can tell you, before I actually went to Stanford, I was just practicing in the Central Valley, and most of people have been farmers there. Personally, I have to say that I've never seen any farmers have a complaint of a sleep problem in my life because they live with the natural daylight cycle. They wake up exactly at the sunrise, they work during the sun, they get the exposure to the sun and light, and they go and sleep at the evening time. And they actually work very well. Their brain cycle is really adjusted to melatonin and natural. But because we are in the city life, we have tons of lights right now, as you probably hear. And I just reading a year ago, there was a very interesting article in National Geographic that when they look at from the space shuttle, the planet is very bright right now because there's lots of artificial lights in the cities. And that's definitely is a toxic for brain because brain doesn't like to be under the light. And that's one of the things we talk about circadian rhythm. It's so important, or body function, or temperature, hormonal effect, obesity, diabetes, depression, bipolar, everything is related to our circadian rhythm. We know it. We know that people may get more metabolic problem or diabetes. Even in the study, we've done it in rats and in mice, that the mice that they're eating later of the night, or they have the habit of eating anytime, instead of like a mice that they have a specific time of the day they're eating and a specific time they stop eating, they are less likely to get diabetes. But the one they have a sporadic pattern of eating, they actually get more. It definitely affects of the vascular system. We know that this circadian rhythm and not sleeping, it affects of high blood pressure, diabetes. We know the story that a gentleman in the 2014 World Cup, soccer World Cup, he died of the sleep deprivation after 24 hours of not sleeping. But again, some people have totally sporadic pattern. Like this gentleman has the 10 hours of each night sleeping, and he's getting more hours of sleep, and he was a very smart man. But the Tesla had a very interesting pattern of his sleeping. He was sleeping a couple hours, he wake up, sleep couple hours, but when we average his sleep, he was sleeping for 14 hours a day. But it was very sporadic, but he gets what his brain needed at that time. But it's so important to understand that why the sleep is important for memory, because we talk about sleep, and in the Randy experience that he actually had a very short sleep. As we know here, the sleep is the most important part of reconstructing of our memory. And it's the time that anything we get in the short-term memory goes to the long-term memory. And this is so important because hippocampal area, this is the place that you see here in the blue color. This is the place that is responsible for short-term and also or learning, short-term memory and also learning. Now, this is the important part that talk about declarative and procedural memory. Okay, now when somebody has like Alzheimer's dementia, what we see here in MRI, that this hippocampal area gets shrink, gets atrophic. And this is why it's so important to understand it. When we talk about declarative memory and procedural memory, this is exactly what we talk about. Declarative memory is technically on the temporal lobe, is about facts and is about events. Like, for example, you remember the anniversary, you remember the birthday. Procedural memory is the skills and habit. For this two part, the sleep is so important because this is the time that you're moving from your short term to long term. Like, for example, today, anything I'm telling you, it goes to your short-term memory, but if you sleep tonight, then tomorrow morning you wake up and say, oh, there was a speaker called Dr. Ayati. He came on board, he talked about the sleep, and he told us many things. If you don't sleep very well tonight, you may not be able to remember the details that we talk about it. And these are the memories that we definitely need the sleep for the cycle. As you see here, which is very well explained, when we are awake, everything's come to hippocampal area, as you see here, sitting there. But what happened during the sleep, everything's get organized and moved to the deep layer of the brain. And when you wake up in the morning, your hippocampal area is completely empty. You're ready for the new information. And what happened to your deep side of the brain is everything is very, very well organized. You see the colors, blue are together, purple and the pinks are together. And this is exactly the reason that we have this. It is so important. We're always saying that it's a common experience that the problem difficult at night is resolved in the morning after the committee of sleep has worked on it. That's absolutely true. I just want to say that it is so important to understand that your immune system is really related to this sleep cycle. We see on a study the people that have poor sleep, the influenza vaccine is not effective in them, and they are having more potential to get cold as well. But one of the things is about light therapy, because light, if we cannot get the sunlight, which again, we are in California, we're lucky, but in many people that they don't have a light, they brought the bright light therapy first time from people in UK and a Scandinavian country because they really they don't have the light in most of the year. But what happened is that they developed the sunlight or light box. And then what happened is during the sunlight and light box, they're starting to give them the light at that time. For people like the teenagers, they're better to give them in the 2 hours early morning. For people older adult, they're better to give them advanced, which we call advanced sleep phase, 2 hours at the same dose in the evening. But then they have to do routine eye exam as well. But it has a lot of effect. Bright light therapy we see in people with dementia has effectiveness on depression, anxiety, and in them in many a study that we have so far. The best time for a sleep for bright light therapy, it depends on what the problem that you have. For teenagers, we need to make the melatonin to be secreted earlier time. That's why early morning light therapy, it's going to be the best time. For people, there are most of the older adult people, most of my patient in geriatric, because they have a problem that they feel sleepy in the evening and they wake up 2 or 3 o'clock, the best time is later afternoon. And this is so important, which is one of the advice I give it to my patient. If you really wanted to adjust your sleep, you better to have the sunglasses till noon and do not go outside. And then when you go outside is early afternoon. Technically, when we get retired, we all getting out in the early morning. And this is the biggest mistake that we do, because when we get light during the morning time, technically our melatonin is going to be secreting earlier in the evening. The best thing for this population is wait till afternoon, stay inside, stay indoors. Early afternoon, go outside and get the maximum sun and light in the afternoon. That's going to help. And if they want to do early morning walk, they should use a very strong sunglasses to not getting light in the daytime. And then later afternoon, walk without sunglasses to getting the maximum light. The effects of the anxiety and light is so important to people of dementia. We see the people with vascular dementia. There's a lot of scores that we see that even 30 minutes exposure to the morning light has helped with anxiety as well. We have a good study from Dowling and colleagues that showed the people with Alzheimer's dementia, they actually have very effectiveness on aggressive behavior. Unfortunately, many of our memory care units, and again, most of them is indoors. We have very limited memory care unit that they have a very big places and they can go outside and they get at the morning light. Some of the tips is the light is important. If you do the light therapy for Alzheimer's dementia, we're not going to see effect right away. It takes maybe 6 months to see that. And again, a lot of people, they say windows is really not important. If you are 2 or 3 meters away from 3 or 4 meters away from the windows, is really not. You really need to have a good exposure to the light. And this is exactly answering the question, the why the hospital and nursing home are the worst place for sleeping, because of the artificial light that we use it in a nursing home and hospital. I want to quickly just say about pharmacologic, because you may ask, this is not a topic we're going to talk today. Maybe another time we can coordinate for have this topic about what are the sleep medication that we use. But I wanted to say something that only time when we use them, when we have chronic insomnia that not responding to behavioral therapy, or there's acute stressor, that we need to use the sleeping medication. Always the smallest dose, and we also have to really be careful about adverse risk effect, because what happened is that it's so important that we know. And there are different types. There are short acting to help to fall asleep. There are intermediate acting to helping you to staying asleep. This is so important. There's lots of them. I don't want to talk about them because it's not a topic for today, but there are lots of the medications are available, and they're also carrying the risk. As you see here, there's lots of risk is here with them, but it's so important. I'm not saying that we do not prescribe. We should be vigilant. We should be smart. We should really find the right person. As I said, like for example, somebody with dementia, prescribing a sleeping medication is a wrong way to go, because it's where is this medication is going to go in which receptors. It is so important that the physicians and practitioner families all together come with a good model of what medications do we need to use, and that's kind of like needs the skills and some knowledge behind that. There are maybe effective compared to placebo. But again, don't forget, most of this study is a pharmaceutical run by that. But again, just want to say that the side effect is there, and we have a loss of mortality, cancer, many other things from this side effect of this medication. And the long-term use of this medication is always caused the habit, because we've developed tolerance. This is the question that we don't know there, why this has happened. And this is something we need to understand. And some of the medication, like for example, about what we call non-benzodiazepine receptor agonists, like Ambien, the famous one, we know there's increase with the risk of fall. And the same thing is like lorazepam. And the use of benzodiazepine or even like non-benzodiazepine receptor agonists should be limited to less than 6 months, because long-term use associated with definitely cognitive impairment and dementia. Melatonin that you buy, which is from outside, may be effective, doesn't have the same side effects that are non-benzodiazepine, but it's very different. People have a very different response to melatonin because we don't have really a right physiologic dose for that. And this is why we have this, which depends on the people, how much the dose of the medication that they needed based on the serum melatonin. And this is why it's kind of like an art of sleep, and also even geriatric, when it comes to what is the right dose of melatonin somebody needs it. Like, for example, many people, they may need a 0.1 milligram of melatonin. If you give them more, it actually makes them more groggy and more side effect. Maybe some people need 10 milligram. Maybe people need 1 milligram. This is why even for external melatonin or over the counter, we recommend to start with the tiny dose and then gradually increase the dose to see the effect. I wanted to just wrap up here that it is so important to understand sleep is not a dizziness. If somebody is sleeping, it's not means that somebody is sick. It means that the body needs to sleep, but we have to also understand about over-sedating and oversleeping as well. It is important to understand change in the circadian brain rhythm. I have to say, if everybody understand his own brain circadian rhythm, natural daylight, and how we can use the sun and the daylight as our therapeutic effect, then you're able to understand your own physiology much better. And there's really no safe sleep aid medication at the end.
Wow. Well, Dr. Ayati, again, thank you. So informative, so much information to digest. So thank you so much for this amazing presentation. Lots of questions here, and we're going to do our best to get through as many as we can. I'm going to start, first of all, with would you consider it to be unhealthy or a cause for concern if a person is in bed for 8 hours of sleep but wakes up 6 to 8 times each night for about 3 to 5 minutes each time? Would that be something that would be cause for concern?
No. But what is the reason? It's so important. If somebody is staying, it's two different situations. If somebody is staying in bed for 8 hours, but has interrupted the sleep, if my understanding is that person wake up for 6 or 6, that means that person really doesn't get enough necessary sleep very well. Number one, we have to find why that person is actually wakes up 6 to 8 times a night or day, or whatever the person's cycle is. There's definitely a reason for it, that person doesn't get a very good maintained sleep. Most of the people, they have to go for urination. That means that if they are using, there's a medical problem that they have to go to the bathroom, or they're using medication that actually makes this interrupted sleep. This is the job of the physician, the job of geriatrician, to review the medication list and make sure this is, or even the medical problem, to see what's the reason the person has to wake up 6 or 8 times at night and then go to the bathroom, or is there any underlying neurological diseases there? But yes, it's if we just stayed 8 hours in the bed, but we have to go 6 to 8 hours, no, that's not healthy. That means there's something wrong. But if somebody really is asleep for 8 hours and is staying in bed, I just say congratulate to that person. It's very lucky, has a good brain, able to do that.
I'm envious of that person for sure. The next question is, does one produce more melatonin during REM cycle versus the non-REM cycles?
No, the melatonin produced during the daytime and then released at nighttime, technically. We get the light during the day, we get the process, and nighttime we're producing the melatonin. Melatonin is kind of like a steady go up. It doesn't matter with non-REM or REM sleep anyway. And this is if my understanding about question is right, melatonin doesn't do anything with REM and non-REM. It's released at evening time whenever based on your local area, as far as like a sunset, it's released whenever it's going to be dark outside. And then this is the time that your brain is start to feeling that you wanted to fall asleep.
Okay. Next question is talking during the sleep. Is that as somebody who talks during the sleep, is that something you can concerned about, or is that a sign of anything, or is that normal?
No, it's just sign as is that person during the REM sleep is not able to suppress the speech muscles. And again, as we said, we all act. Some of us we acting out or dreams at night. The people also asleep talking is the same problem. They talking in the dreams, but they're not able to paralyze their speaking muscles, and this is very genetic. A lot of people hereditary, they also get this as well, and then they talk during the sleep. This is nothing wrong about it. This is the way that they are. This is the way they are, and it's very interesting. Sometimes they even tell all their secrets at night during the sleep. If they have the partner or someone, they can learn all about their secrets at night.
Very good. The next question is, what is your suggestion to family caregivers that are caring for their family members with dementia, and the dementia patient or the dementia family member is waking the family members up at night during their natural sleep patterns? What's your recommendation for that family caregiver who's in a situation
It's a
like
very, very good question. I mean, the problem is that most of the time we wake them up for changing, like for example, changing the pull up or something at nighttime, and technically makes the interrupted sleep. Is it the question is about that family caregivers? If my understanding is that first of all, the people with dementia, they if they are very lucky, they may will sleep straight and they don't have the sporadic sleep pattern. But we always recommend to minimize any interruption at nighttime. And this is the same thing for memory care as well.
Yeah.
To any interruption at night as much as we can. To let them, their brain, again, with the dealing with all the damage and broken system, to kind of like adjusting itself with the sleep. And this is why I know a lot of people are very sensitive about it, but again, I completely understand because sometimes when they have bowel movement and urination, it causes the urinary tract infection as well. But as far as we do, I will say the same protocol that we use for the babies, we try to not really make the light on, it's not making a lot of noises, is try to do it as much as slowly and quiet that we can. I've observed that in many other places in memory care, they do this protocol and they try to be very calm and quiet when they're doing this ADLs. As far as if you can do it and makes the situation to not make their brain to be awake, because otherwise they're going to be awake and agitated at that time.
And for the, let's say for the person who's still at home, maybe their spouse is caring for them, and now that spouse is not getting a lot of sleep themselves due to interruptions. What, any recommendations or thoughts for that person and how to regulate their sleep?
It's exactly one of the major problem for many people. That because the loved one has dementia and doesn't have a very straight to sleep pattern and wake up multiple times at night. And it's sadly, I have to say, this is the time that most of the time the family decides to move their loved one to the facility. I mean, as I'm saying, this is sadly or not, but this is the time that really cannot do that because it's very difficult. And caring of the loved one with dementia at home is very, very difficult. Especially night will be the time that they're going to have a very, as we explained, a sporadic sleep pattern, not let the other people asleep. And or maybe the time that they need to find someone to come and help them at night, someone that be awake, and anytime when they start to wake up and wanders, be with them to make sure they're safe. And again, some of my patients, they get asleep like 2 to 3 times a night. They get a caregiver at home at nighttime, and at least what they have respite sleep time, that they have at least 2 to 3 nights a week they can sleep, and the rest of the week that they know that their loved one's going to be awake, and they do that. Again, it's very hard because if you give a sleeping medication to family caregiver and their loved one has dementia, it's going to be unsafe because they're going to be in deep sleep and they're going to be wandering around, and it's still in home environments can be dangerous. Honestly, most of the time for my patient, if there's no any problem, this is the time I recommend to take them to a place, to a memory care unit, because at least, especially when the loved one, and again, the partner or a family caregiver is also in the geriatric zone. And I'm very worried about their health as well, if they're not able to sleep at all. And these are exactly the discussion that we have with the family most of the time.
Yeah, absolutely. That makes sense. And I guess the next question I've got, Dr. Ayati, is there a recommended for the bright light therapy timing? So for somebody who's got Alzheimer's or dementia, and they have sporadic sleep cycles, is there a recommended timing for BLT?
It's a good question. My suggestion for the people with dementia, I put them in the category still of the advanced sleep disorder, and I actually say early afternoon time. It's the best time that we do bright light therapy. It's not my suggestion. It's the same model that they do in many of the memory care units in other countries, in UK, in the Scandinavian countries, they do it as well. In Australia, they do it. Japan, they do it as well. They actually do early afternoon bright light therapy for many of their residents with dementia in their care homes. And they've seen a good result. They even use it when they are getting admitted to the hospital in the early afternoon time. And they see that even in not helping them for 3 to 6 months to sleep, but they're more calm. And actually, one of the other things that they can see, sundowning behavior, which is exactly the result of the lack of the lights, especially when the outsides start to become dark. This is exactly the reason. Part of the circadian brain rhythm is sundowning, which we see in the dementia people. That can help significantly with sundowning as well. Much better than any medication.
Okay, wonderful. If you are a morning person, what's the best time to get sunlight?
Early afternoon. If you are a morning type person, wake up, then you better to not getting out of the house till early afternoon. And probably the best time, I will say, is going to be after 1 p.m. Try to get the maximum of light between 1 to 3 p.m. If you go outside at this time, do not use any sunglasses if you can. If some of the people, because of medical problem, they have to do sunglasses, just make it very limited. And that situation, that can help significant, but not during the daytime. If you have to go outside during the daytime, like from morning till noon or early afternoon, definitely use the hat or the strong sunglasses.
Okay.
And the other advice that we just forgot to tell is about watching TV or computer, and the light can be also confusing for brain. There is also a possibility that that they can do use sunglasses when they watch the TV or also look at the monitor. There are specific sunglasses for monitor and TV also, which can be very helpful.
Wonderful. Okay. I think we've got time for just maybe 1, 2 or so more questions. Are there any sleep disorders or patterns that are considered symptomatic or a sign of early dementia?
Are there any specific? I'm sorry, I just lost.
Are there any specific sleep disorders or sleep issues that might be a sign of potential onset of dementia?
Very good question. The scientists are wondering for many years that a sleep deprivation or lack of a sleep is one of the risk factor for developing cognitive impairment and dementia. We haven't found, neuroscientists haven't found that people like, for example, have a sleep deprivation, it's a sign of early dementia, but they know people that they don't have a good sleep pattern is much higher risk of developing cognitive impairment later. And there is possibly that there are some neurodegeneration is happening to the brain that we're not aware of that. And again, we cannot recognize it or finding an image at the technology at that point. Maybe we will find it in the future. But it is important that we understand as of now, if we have a sleep problem, we definitely need to take it seriously and discuss with our provider. And if there's any treatment needs to be done, they can do it at that time.
Wonderful. Okay. What can you say about people who have really active dreams, like with nightmares? Are there any known treatments for that?
If they have a very severe, yes, they have. There are some sort of the medication which in the category of dopaminergic medication, which we call it, again, the same medication we use for people with Parkinson, they have, but very low dose. That doesn't mean the person has a Parkinson, but technically we use a very tiny dose of this medication if their active dreams is problematic or they have REM behavioral sleep disorder that is causing a significant problem. Yes, these are the medication that we use.
Okay. All right, I think we can squeeze one more in here. And first of all, for all those who submitted questions, apologies if we can't get to all. again, this has just been so informative, and Dr. Ayati is a wealth of information. So thank you, Dr. Ayati. The last question I'm going to just throw your way is, how does hydration affect sleep? Does hydration have any impact on a person's sleep?
It helps with the good blood circulation, of course. It helps with the brain circulation. Definitely, it helps with the clearance of adenosine, which I explained in my presentation as well, because you have a better flow of your spinal fluid as well. It helps significantly. However, there's on the other side, if you do too much hydration, you may have to pay back in the nighttime with going for more urination. It should be very important to have a balance and what is the time of the hydration, because on the other side, we see especially in older people, on the other side, the too much hydration also can cause some problem. It is very important, but yes, it is effective, but timing is also so important.
Wonderful. Well, again, Dr. Ayati, I just want to say I've been just overwhelmed. There's so many comments coming in. Everybody is very appreciative of the information. It's been very fascinating, very informative. So on behalf of everybody who's joined us today, I just again want to say thank you so much for sharing this very important presentation and information with us today. And for all those who did join us, again, on behalf of all of us here at Silverado, Dr. Ayati, I want to say thank you so much for taking the time to join us today and be with us today. So thank you all, and hopefully everybody has a great night's sleep tonight.
Thank you. Bye.
Bye-bye.